Hello friends, welcome back to my channel. If you're new here, my name is Dr. Jaime Canada, and today is part 4 of the Better Bladder series, in which I will be talking about urge suppression techniques in overactive bladder. Be sure, if you are on Instagram or TikTok, to give me a follow at Loom Pelvic Floor PT to see more content there. But before we get into today, I just want to check in with you all and make sure that you've watched part 2 and 3 of the Better Bladder series. So this is assuming you've 1, filled out your bladder diary, and 2, have watch the video where we interpret it, because now we'll be implementing some of those techniques based on the habits that you notice. So today's focus will be on urge suppression techniques, and these are the techniques that we'll use to create that longer interval between voiding, as well as preventing leaks as we get that strong urge to go to the bathroom. The first technique, and this is probably one of my favorites, is called quick flicks. So what quick flicks are they are doing pelvic floor muscle contractions, or also known as Kegels, multiple times in a row to help disrupt the signal from brain and bladder so that we can prevent that urge or having to rush to the bathroom and having leakage. I like to have patients start out doing these quick flicks, doing about 4 or 5 Kegels in a row. The reason that this works is because performing those pelvic floor muscle contractions actually helps relax the bladder. So the bladder has an inverse relationship with pelvic floor, meaning the actions are going to oppose each other. So as we've talked about in previous videos, in order to urinate, the detrusor muscle has to contract, so bladder contracts, and then that allows the sphincters and pelvic floor muscles to relax, allowing urine to come out. So if we think about it, overactive bladder causes more of that contraction of bladder, the spasming. So in order to help decrease activity of bladder muscle, we can perform pelvic floor muscle contractions, which then inversely will help relax bladder. So they kind of do the opposite, and this helps to suppress the urge to urinate. If you've never performed a Kegel before, and you're like, what is a pelvic floor muscle contraction? I can do a video separate on this, but what I want you to think about is to isolate your pelvic floor is thinking about sucking up a smoothie into your vagina through a straw, or picking up a pea with your vagina. So it should be a really small muscle, really small movement. If you feel that your butt or your inner thighs are doing a lot of work, try to keep that quiet. We want to really help isolate, do those 4 to 5 Kegels in a row. And you can do those 4 to 5 multiple times, as many times as you need to help suppress the urge. The second is going to be putting pressure down by your privates or your saddle. So if you ever had to go to the bathroom when you were little, you may have kind of held your private parts, applied pressure to help you not wet your pants. So this is a similar idea, but this time we're going to apply pressure using a towel. So I went ahead and grabbed a towel here. So washcloths can work, but like a bath towel, like a smaller bath towel or hand towel works good. So what you're gonna do is you're going to take that and roll it up. So it's a nice little lump here. So then what you're gonna do is, I'm gonna back up so you can see me. You're gonna place that on your seat so that it's applying pressure in that saddle region. So there's no specific time of like how long to do this. Honestly, I have had patients like carry a towel roll with them, like in a purse, or if they have something else that they can use in their bag that provides a little bit of cushion that can work. So let's say you're at a doctor's appointment and you're like, wow, I really have to go. I just went. I want to, do some of the suppressions to wait until a better opportunity. Or you're walking around and you get that sudden urge, you can find a bench, place that under, and sit until that urge is gone or dampened. The idea of using pressure at your saddle region is that it sends those similar signals as when you're contracting your pelvic floor, relaxing bladder. That pressure helps to relax bladder as well, therefore suppressing the urge. If you don't have the towel or you don't feel comfortable with that, you can use hands applying pressure up, like when you were younger. Also, crossing your legs to give you a little bit of squeeze. But also, if you're walking, standing, just sitting, naturally, you're going to get a little bit of pressure up from whatever surface that you sit on. Those can all be helpful. The big theme here is trying to relax bladder, right? So the next thing we're going to talk about is general relaxation strategies. One thing I love to implement with patients is breathing techniques to promote that relaxation of the nervous system to help decrease the urge to go to the bathroom. So one of these techniques is called box breathing. So you're going to inhale for 4 seconds, hold, exhale for 4 seconds, hold, and you'll continue that for 4 breaths. So that's 4x4 breathing. Another technique is parasympathetic breathing. So you're going to be inhaling you can do this a few different ways, but we'll say for 5 seconds and then exhaling for 7. So inhale, exhale, and so on, repeating that as many times as needed. You can set a timer for like a minute to 2 minutes, or you can go through that 5 to 10 times, whatever you feel you need to do to help suppress that urge, or however much time you have. So I'm just gonna go through a couple more for this video. The next one may seem a little silly, but I think it is very beneficial. So it's going to be more of distraction techniques. So when you get that urge to go, what can you do to distract those signals, if you will, through your actions? So what I mean by that is, could you, when you feel that strong urge, say, hey, I can slow down, I can do this, write out your grocery list. So having like a to-do list, pulling that out, or writing down things you have to do to help distract yourself. Another thing could be solving math problems or something that really requires a lot of brain power. I am not good at math, but if you can like count backwards from numbers, like backwards from 3 from 100, go for it. That is really going to take your mind off that urge to urinate. Some people, they like to have conversations with their bladder, and they might say, hey bladder, I'm okay, I just went to the bathroom, I don't need to go. Kind of talking your expectations into existence, if you will. Like verbally training your bladder, which may sound silly, but it works for some people. If you're like me, like I will sometimes have conversations like with myself in the car about like my day or things that I do. So same goes for bladder. It can really just give all your attention to that task and less away from your urine situation. I know that can be a lot of examples, but I want to give an example about how to implement this for specific circumstances. So I'm gonna give the example of the person that gets a strong urge to go to the bathroom every time they put the key in the door when they're getting home. So that is a specific activity trigger causing that urge. So what I want you to do is start out by picking one urge suppression technique. So you know that that specific activity typically triggers you to feel like you have to go and rush to the bathroom. So as you're doing that, lock and key, you get that trigger, I want you to pick one of the techniques we talked about. So maybe that's, hey, as I'm doing this, I'm gonna go through the 4x4 breathing, or hey, I'm going to apply a little bit of pressure up at perineum, hold that while I do that, and give myself some time, and then enter the house nice and slow. So you pick, you can change it up as you want, but I want you to kind of stick with a specific one for that day. And then if that seems to work, continue that and to lessen those signals to bladder. If it doesn't work, try the next suppression technique until you find one that seems to work the best for you. If this seems overwhelming, honestly, just try to slow down everything you're doing. So instead of racing into the bathroom, try to walk slower. Instead of ripping off your pants to get on the toilet, try to go slow as possible. These things might sound scary because you've had experience with accidents and whatnot, but if you can kind of start to do these at home, when in case something happens, you'll be more comfortable to try to go longer without having to urinate. Some urges with these techniques may be only slowed for a few seconds to start. So maybe the key in the lock, oh, I could kind of suppress that for like 5 seconds, but then it came back. But the more and more we implement this, we're literally retraining our bladder, the longer you'll be able to go between urinating and being able to hold off the urge to prevent accidents and leakage. So something to mention is paying attention to a true urge versus a trained urge. So a true urge might come from intake of bladder irritants, if you haven't gone in 2+ hours, so those normal things that would cause us to have to go to the bathroom, whereas paying attention also to maybe it's more of a trained event that we have, such as like key in door, going just in case before shopping, you name it. I want you to really pay attention to when you get an urge, asking yourself, when was the last time I went? Did I have any irritating food or beverage 30 to 90 minutes prior? And am I in a situation to try my suppression techniques and hold off for a little while? There are other techniques that you can try, such as timed voiding. So this would be, I may prescribe someone, you're gonna go every half hour for a week, and then increasing every hour for a week to 2 hours, and so on. This is going to be a little bit more of a severe case if you are not getting success by changing bladder irritants or habits, and if the urge suppression isn't working after 2 to 3 months. So that is also an option. And if you're still not having success, or you just are saying none of this is really working for me, sometimes these urges can be due to a backup, like constipation. Constipation, surprisingly, can really cause a lot of our urinary issues. So that's also something to consider. Anyway, I hope this was helpful. Please, please, please try out these techniques when you're getting your urge to urinate. And remember, everyone's normal is different, but don't worry about going too hard in the paint. As long as you're within that like 2 to 5 hour intervals and you're not going just in case, then use those urge suppressions when needed to prevent leakage or to increase the interval between when you have to go to the bathroom. So hopefully this was helpful. I will share my last video of the series very soon, talking about proper positioning and technique for going number 1. So thank you. I will see you guys soon. Bye.